Hello, dears, and welcome to Al-Hussaini Virtual Lab Pathology Talks, Tips, and Practical Tips. Today, I'm going to share with you this interesting case on leukemia cutis. So this is a 40-year-old male patient with AML who developed the skin rash. And the primary impression or the primary differential diagnosis that was raised up was whether this is fungal infection or not. So this, as you can see from low power, the epidermis appears to be in general unremarkable, as is the keratin layer. And the superficial part of the dermis appears to be unremarkable as well. Really, it's the deep part of the dermis which appears to be busy. So there is something going on here, and here as well. So focusing on this area on high power magnification, as you can see, we have the sweat gland ducts as well as vessels. And then there is really this infiltrate in between in the dermis. And the infiltrate is kind of monotonous. There isn't much variation. It's composed of those cells with pale nuclei, some with a prominent nucleoli, and with eccentric placed nucleus with a granular acidophilic cytoplasm. And they are all replica of each other. It's all the cells are exactly the same. So again, this is another power from the another focus from the lower dermis. And the vessels, and in between we have this infiltrate that is really very monotonous, and again, some with a prominent nucleoli, some with acidophilic cytoplasm that is eccentric and granular. So really, whenever you encounter such an appearance in a patient with leukemia, especially AML, we have to think about leukemia cutis. How to prove it? Very simple. With one single immunohistochemical stain, MPO. MPO should not be staining precursor cells like these in the dermis unless the patient is known to have leukemia, and this is leukemic infiltrate. Normally, the MPO would be positive only in mature neutrophils, but not in immature forms of cells like these ones. So again, put side to side. This is the infiltrate, the monotonous infiltrate in the lower dermis with pale nuclei, some with prominent nucleoli, and with a little bit of eccentric acidophilic cytoplasm that is stained positive with MPO stain. This is diagnostic of leukemia cutis, and it really matters. It's important to render the proper diagnosis and to communicate the diagnosis to the treating physician. I hope you find this tip useful in your daily practice. Thank you.